Hi everyone. Welcome. My name is Veronique. I'm the account manager for Eastern Canada at Pedicare. So I work with the Ontario, Quebec, and Atlantic provinces region. I actually lived in New Brunswick on the East Coast. And we also have my colleague Amy. So Amy, if you want to introduce yourself.
Hello, everyone. I'm Amy Jo. I'm the Western Account Manager.
Thank you. And so Amy and we will be your point of contact for your ToeFX product needs in Canada, whether it's equipment, serum pens. Pedicare is the exclusive distributor for ToeFX products in Canada, and we're proud to sponsor tonight's webinar with the ToeFX team. If you're not familiar with who Pedicare is, so we have been providing innovative foot care products across Canada since 2026. And we have been distributors of the ToeFX system for many years. We're really excited to share how this technology can improve patient care and how it can contribute to the evolution of your clinic. We will also have exclusive promotions available for tonight's participants. So make sure you stay tuned until the end. We'll talk about that. Before I hand it over, I'm going to give you a brief introduction of our speakers, so Irit and Radida, before they start the training. So for Irit, so if you don't know already Irit, I know a lot of you do. She holds a PhD in pharmacology from Tel Aviv University and completed postdoctoral work at the University of Ottawa. She held senior positions at Teva Pharmaceuticals and the Ontario Ministry of Health and is an expert in formulation development. Erit is the Chief Technology Officer and co-founder of ToeFX Inc. Also from the ToeFX team, we have Ridita Noor. So Ridita is the account manager at ToeFX. So she's available to assist you with any questions on the devices and PCR tests. So I will hand it over to, I'm not sure who's starting, probably Dr. Reed.
Yes, I will start. Thanks, Veronique. So let me share my screen here. You can see my slide, right?
Yep.
So, hi again, everybody. I'm very delighted to present today to you. It's basically a short summary of things that we are doing at ToeFX. So I will cover onychomycosis treatment, also diagnostics, which it's very close to my heart, and I think it's super important. Some new activities in diagnostics, including AI, and how light therapy is perceived around the world. So yeah, now you know me because Veronique did a wonderful introduction. So we can skip to the next slide. Oh, okay, sorry, it doesn't. Okay. So I wanted to start today by talking about the history of light therapy. So light therapy actually was discovered more than 100 years ago, actually even 140 years ago. So it was first discovered in the 1900s. Raab and Von discovered how biological systems react to light and dyes. So then it was really amazing that they discovered that. In the 20s, it was a really major discovery where porphyrin era. So they discovered this amazing molecule that can absorb light. In 1970, and actually the compound that we are using belonged to this family. In 1970, it was the renaissance of modern photodynamic therapy with the first large-scale therapeutic application, including cancer. I will talk about that a little bit later. In 1993, which is not too long ago, official FDA approved for photopherin in treating specific cancer type. So, and in 2000 actually, and until today, a global expansion of dermatology and personalized nanoparticle medicine using photodynamic therapy. And actually, I just came back from a conference in the States, in Chicago. It was all about regenerative medicine, and they talked a lot about biophotomodulation. So it's really using a lot now in wellness and medicine, using light. So here you can see some of the application of lights and clinical studies. You can see that it was used for acne, chronic wounds, onychomycosis. We have developed a treatment for onychomycosis, but there are a few other papers talking about that. So I really like this slide because here you can see really nicely how few diseases I am being treating with photodynamic therapy. So it's starting from retinal diseases, and then lungs, bladder, skin cancer. So it's basically all the organs that the light can penetrate because they don't do it within the body, and they can apply a photosensitizer, a molecule on the organ, or sometimes inject it in terms of cancer. Here you can see how it's used in dermatology actually a lot. We are using a blue molecule, but in acne, they're using a molecule that's called ALA. We cannot unfortunately use it for a foot because it takes many hours to being activated. Actually, it's a precursor, but for acne, it's used to kill the bacteria that causes acne. Here you can see how photodynamic therapy is used for oncology. And here, this is how we are using it. So it's antimicrobial photodynamic therapy, or in other words, photo disinfection. You need, this is, here you can see, this is infected nail. You have the formula that we actually have patent for the formula in many countries around the world. You do the treatment where you apply the formula on the nail. We can talk about that later. Apply the light, and then you get a resolution. And here you can see some before and after. So this was the background of photodynamic therapy. I just wanted you to see how it's used all around the world and in other modalities. Here you can see those are cases that I'm sure most of you have seen. Distal lateral subungual onychomycosis. You can see here on the left-hand side. Those cases are often harder to treat because it's reached the proximal edge. This, for example, had the dermatophytoma, so it means that there is high concentration of fungus and spores. But not to worry, ToeFX can treat that. This is total dystrophic nails. Those are all those cases actually we treated in our clinical study. Here you can see a rare cause of onychomycosis, so it's proximal subungual. It's often start from the distal, so when you see something like that, it's rare. And here you see superficial white onychomycosis, which is easier to treat. So what are the challenges of treating onychomycosis? and how I wanted you today, because I gave this lecture a few times. Today I wanted just to highlight the findings of our paper that actually was accepted and published in one of the best journals in the States. It's the Journal of American Medicine Podiatry, so JAPMA. So most studies do not focus on severe cases. They focus on mild to moderate cases. Severe infections are very challenging to treat because it's thick. There is high accumulation of in fungus, and it's does not, most of the solutions does not reach the, if unless it's oral, does not reach the nail bed. The nail matrix may be damaged, reducing capability of health growth, and even the infection is even if the infection is eradicated. Another something very excited. I just wanted to confirm, Amy and Veronique, you see now the ugly slide with the wounds, right?
Yes, I do.
Yeah. I hope nobody is eating. Um, so we had decent amount of clinicians that actually use ToeFX off-label because it's photodisinfection technology. So they use the serum together with the light to treat wounds. Some were pressure wounds, some were diabetic wounds, but the results are really outstanding. Just today, someone showed me a really good progress. And because of that, we are actually going to start a study at ToeFX just to look at using similar technology that we have for onychomycosis for wounds treatment. So it's very exciting. So let's go back to onychomycosis. So those are the available solutions for onychomycosis. So from left to right, we have Jublia, efinaconazole, we have terbinafine, we have lasers, and we have ToeFX. So those two, and there are other topicals. So I wanted to focus just a little bit about the difference between lasers and ToeFX. So lasers eradicate the fungus by creating thermal effect, heat, where ToeFX create reactive oxygen. It's totally different. There is no burning sensation to the patient. It's also much more effective because we are treating all the surface at once. So basically it's oxidizing the fungus. Also, a very major difference is that thermal effect, so it's 50 to 55 Celsius, it's destroying all the tissues, also the epidermis, like also the healthy skin. ToeFX, because the affinity of the serum is much higher than to cells that divide rapidly, such as bacteria, fungus, yeast, and the affinity to skin is not as efficient, so it's very selective to fungus cells. So again, a little bit about our study. So we had some exclusion criteria of age, but actually then we decided to take older people, and it's very important to say that because the way fungus behaves, so the worse it is, the worse it gets. The reason is that if you take a nail sample, for example, you trim infected nail, toss it, put it in a black paper, toss it in a corner of the room with no moisture, no oxygen, nothing, it will survive because it only needs keratin. So if the nail is getting worse, so mean that it's thicker, there is lots of inflammation, and it's super dark, so the fungus is there to stay. And also then it's harder to treat it. So why did we use a light therapy for a severe onychomycosis? So patients with severe onychomycosis may be seniors who hesitate or can't take oral medication. There is could be contraindication. Other people just don't want to take oral medication because they are concerned about liver toxicity. Many people are looking for non-toxic and safe treatment and that it's done for them. And there are many clinicians that embrace the idea of combination therapy. So what's good about ToeFX that you can combine it with any other solution that you have. There is no contraindication. So just a little bit about how we characterize the patients for the study. So we looked at, we actually, just a personal story. We started our first study together with COVID. The timing was not so great. The diagnostics was not so great. We sent around 200 samples before COVID to the lab. Many came back negative because I will talk about it later. The culture is really not accurate. So when COVID hit, we had patients older with severe case. So we're thinking, okay, should we wait or should we start? And because I personally don't like to wait, so we took our chances and it's worked really well for severe cases. So this is how we defined our angle. ToeFX, because it's a combination of a formula, light, and debridement, so we tackle it from biological, chemical, and physical aspects, it's working very well. So we looked at 165 severe cases. The average age was 60. I think the oldest person that we treated he was 90. 80% of the patient has chronic infection, meaning 5 years and longer. We did it in 3 centers. And the diagnostics, later on we developed our own PCR, so we did it through a KOH, culture, and PCR. So 90% of the nails that we looked at were severe cases. We actually classified them to severity class 1 to 4. But 92% were severe cases. So we did it in Hamilton, British Columbia, and Windsor from 2020 to 2023. So another something very unique about the way it works, so the affinity of the serum, so you need a serum, you need a light, and you need oxygen. So what's nice about the technology that the serum binds predominantly to the infection. So you can see here, this is a confirmed case of onychomycosis, and this is how it looks 2 weeks later. So you see that the infected area is blue because there is fungus here. So the rest of the nail plate, it's washed away, but it adheres predominantly to the infection, so you can use it as a marker to tell you where the infection is. It's also super cool because the patients can actually see the progress. So sorry about this data, too many information, but you see we classify to severe class 1, class 2, and class 3. You can see that 143 out of the 165 nails were severe. Here you can see the efficacy of 73% and mycological cure of 60%. Those are some before and after. So this is a typical course of treatment. So this is a confirmed case of onychomycosis. At T2, you can see how extensive the debridement is, but you can see how nicely the blue adheres to the infection. And here at T6, you can see how new nail came in, but the corners, the lateral and medial, are still infected, which was resolved over time. The distal edges are sometimes blue, just because this is how the serum behaves, but it doesn't mean that there is fungus here. Those are the cases that we treated. It actually was taken from our clinical study. Here you can see total dystrophic nails. Here you can see some of that has a dermatophytoma, so those patches of spores of infection. Those are some case studies, so before and after 6 months, before and after 6 months. So you can see for yourself how nicely the progress is. Again, the blue at the distal edge, it doesn't mean that there is fungus there. And this is very exciting, just to finish this part. So this is a pressure wound. This is the before, and this is how it looks after 10 days. This clinician did only 3 sessions, so of course debridement of the area, applying the serum, and then shine the light. Again, this is wart. So again, filing down the wart and applying, you see here a bit traces of the formula, but applying the formula and shining the light. How about, because now I wanted to talk about diagnostics, so how about we take a short break? Maybe we'll see if there is questions. I will answer the question related to the technology, and then we can switch to diagnostics. This is, by the way, dermatophytes, so it's a super cool slide.
If anyone has
See,
questions,
Cayman is raising his hand, so I'm allowing him to talk.
Sure.
Hi, Cayman. You can unmute yourself and you can speak.
sanırım ben bakın şayet bir dünya diye.
Sana gelmezsin şey diyoruz. ما خیلی زیاد حالا دیگه هیچی عوض نشد اون بچه بازم
Okay, I guess.
Okay, we have
I
Rachana.
see Chen,
Rachana
yeah.
is also raising hand. Rachana, you can unmute yourself and yeah.
I have 2 ladies that on ToeFX treatment, and we have hit 16th treatment, and the fungus is so stubborn. And I'm just wondering, because this has been a pattern for my clinic, anyways, is the hormone plays a role on the effectivity of this?
Hormones?
Yeah,
What do you mean? Which hormones? No, I
like
don't think so.
they both kind of like not menopausal. And I felt like all this age group that I have that are not menopausal, their fungus is so stubborn. I did have, sorry, I'm still recovering from flu. I
Oh,
did have couple of older ladies that are menopause, and we hit 10 treatment and it was all clear. So I'm just wondering if the hormones actually plays role on for the fungus to be stubborn.
not that I am aware of, but maybe we can book a meeting and just look at those 2 cases and brainstorm.
Oh, sounds good. Thank you so much.
You're welcome. So maybe just reach out, and so I would love to look at the pictures.
You bet. Thanks.
Okay.
And I see a question from Cynthia. She's wondering if we can use light therapy already on wounds, or is it in early stages of study?
Yes, we haven't started the study yet, but you can use it off-label. And if you want to know how, so again, please reach out. I can gladly educate and share the protocol that we have for this, that we have prepared for our study. I can gladly share it with you.
And then Sherry Ann is wondering if the blue serum needs a doctor's prescription or if it's over the counter.
No, it's not. It neither. So it's not over the counter. It does not need a prescription. It's a medical device. So it's a medical device cleared by Health Canada. It's class 1. And it can be used in conjunction with the light therapy, which is class 2, also cleared by Health Canada. So you need to purchase it from Pedicare.
And then Shelley is wondering if this is a scope of practice issue in regards to off-label use for wound care.
I need to look into that.
Okay, and Elsie is wondering how many treatments does it take and what the cost is.
So for onychomycosis, it takes about 10 sessions bi-weekly, every 2 weeks. And the cost, I guess, we'll discuss later.
Yes, we will.
And I'm happy if you reach out, Redita and me, we can share the protocol.
Yes.
And then Sherry, she says she's an AFCN and she wants to know if she can use it to treat her clients or if only podiatrists can.
No, sure you can. Yes, by all means, of course.
And then Linda Dawson has an interesting question about the type of blue that's being used. She has plenty of experience with methylene blue 1 and 2%. She's used the light on all kinds of wounds and even on her dog's bad back.
The ToeFX formula is very unique. We use a lower concentration of methylene blue, but the methylene blue, the way you can buy it is not stable, and it's not going to react so well to a light. And also it's not cleared by Health Canada, so it needs to be allowed to be used on humans. And also in the formula we have 3 components, a dye, we have organic solvent that stabilizes it and also helps with the penetration and also kill the fungus. And also we have botanical extract with antifungal and anti-inflammatory properties. So if you leave the formula after the exposure to the light, it will continue to work for a couple of more hours. So actually we ask after the ToeFX treatment to ask the patient not to take a shower right after.
Okay, and Monisha is a first-year chiropody student. I'm curious to know, what does the serum exactly stain blue? Is it the fungal hyphae? Thank you.
Yes, and also not only the fungus hyphae, it's the way it works. It penetrates to a membrane of microbes. So it can be Pseudomonas, it can be dermatophytes. So it's penetrate to the fungus wall and stay there. And once you shine the light through the blue dye, it's like a mediator. So it's taking regular oxygen and convert it to reactive oxygen within the cell, and it's destroying the cell. So it's like when you have, this is the fungus, so it's like creating with a needle, pinch a hole and it bursts.
Right, thank you. Berka has a question about the percentage of efficacy, but I noticed that she's had her hand raised for a little while, so maybe we can bring her in and have her speak. If Fredita, you can do that.
Yeah. Go ahead. Mhm. Mika, you can unmute yourself and you can ask your question.
Oh, she can't unmute herself.
Maybe you can type it?
Yeah, so her question was, so it says 72%
Oh,
efficacy.
Oh,
oh,
now
okay.
you
Now
can.
here
Oh, she's
I
on.
think I can speak now.
Okay.
Yes, great.
We hear you.
Sorry. Yeah, so I just wanted to ask because it was mentioned 72% efficacy, and I was just wondering what about the other patients, let's say, who are not successful? And in particular, I have a question of cases such as the ones I noted who have some issues with circulation to extremities, in particular after some sort of mechanical injuries to their toes or feet, and then just 1 minute, and then the circulation is impeded. So I noticed that those cases in particular have fungus. So how does that affect those who actually we will treat this? Will the fungus come back?
So, with compromised blood circulation, yes, this is the reason sometimes, or a depressed immune system, this is why people get fungus. The efficacy in this case might be, I mean, the nail growing will grow slower than normal nails, so this is why you will see progress slower. There are ways to increase the blood flow into the nail, also with supplements, but also with other ways, such as red light, or to use it more. So we can definitely talk about that if you like.
Okay, yeah, perfect. Because I notice, when I do some interviews with patients, it turns out that a lot of them who actually have fungus on certain toes, not necessarily all of them, that they did sustain some sort of a mechanical injury. Something was dropped on the foot or on the
Yes,
toe. Yeah,
of course. It's often something that causing the nail structure to be compromised, and then the fungus
yeah,
can find their way in. So
right,
it's often it starts from mechanical issue. Yes.
right. And so when it's treated, it's quite successful in those cases as well, right?
Yes.
That's
Yeah.
it. Okay. Okay. All right.
Yeah.
Thank you.
You're welcome. Should we continue with the presentation and attend questions after?
Yes.
Right?
I think to, yeah, get this presentation along, we do have a few quick questions that we can answer. So quickly for Linda Dawson, she's wondering if we're recording. And yes, we are. And we will be sending a recording, a link to the recording afterwards. We have Sherry wondering if it's applied once a day, and the ToeFX serum is applied once every 2 weeks for 10 up to 10 treatments. And I think for the rest of the questions, we can save them for the end.
Okay. Just a second. So this part of the presentation is about, I wanted to talk a little bit about diagnostics of onychomycosis. So onychomycosis, it's something that everybody on this session well known. You know it, for you treat it, you see it every day, and it's very common. It's chronic, and it's not just cosmetics. And I truly believe that the reason that until lately there was not good diagnostics for onychomycosis is just because all the medical field were perceived it as they knew that it's an infection, but they looked at it more as cosmetics, and it wasn't a priority to develop diagnostics. But it's not really just cosmetics. Patients with onychomycosis experience embarrassment. They experience avoiding shoes because they have pressure on the shoes, so it's super painful. They're shy to wear sandals. They're avoiding social setting because they have fungus. And it's also highly contagious. So I think that it's super important to diagnose and also treat and help those people. So, in the nail growth is very slow. Clearance is very slow. And when the treatment fails, it's also very slow. So everything is very slow with the nail. But with patience and good treatment, you will see good results. So let's start with the core cause of onychomycosis. It's our friend, the dermatophytes. Dermatophytes are responsible for about 70% of the cases. They are the biggest category. They are target most of the treatments algorithm because it's mainly dermatophytes, and mostly when they culture they look at dermatophytes, but it's not only dermatophytes. Yeast, for example, can account for 2 to 8% of onychomycosis. And it's a bit loose. It can change from area to area, but it's not only dermatophytes. So we talked before about ToeFX treatment. So ToeFX, it doesn't matter if you have dermatophytes, candida, aspergillus, or pseudomonas. They all have membrane. They can all absorb the formula, and they will all respond to a light. So it doesn't matter, but it's good to know that you're dealing with onychomycosis because 50% of the visual diagnostics are not correct. So if you think that it's fungus, it's not. So here are a few nice ways to look at this is dermatophytes, Tacrophytum menagrophytis. So this is the KOH, so they basically dissolve the keratin. Take a drop and put it under the microscope. This is super, super hard to see. Only skilled technician can see it, and they often miss. Believe it or not, they miss. PAS, they stain the hyphae, and it's easier to see, but still. And this is culture, where they stain with fluorescence the culture, so it's super cool. This is candida, and you can see sometimes appearance of the nail is a bit different, but it's hard to tell. Only if you have a special microscope so you can see. Again about onychomycosis, and I'm sure that you know that, but I just wanted to repeat that. So there are 4 main classes: DSO, PSO, WSO, and TDO. So distal subungual onychomycosis, proximal subungual that we said that it's rare, white superficial onychomycosis, and total dystrophic. Of course, total dystrophic onychomycosis are harder to treat. So especially when we look at total dystrophic onychomycosis, sometimes it's super painful for the patient. And I believe that part of the treatment, other than clearing the fungus, it's also helping the patients with the appearance of the nail. Some of them had the onychomycosis for such a long time. So there are a few methods to actually help and encourage the nail to grow out. There is a tape that you can use. There is Onyfix that you can I think you offer Onyfix, right? Yeah, you can get through Pedicare, and there are other treatments just to help with the nail appearance. So here is a little montage. I liked this slide because it reminds me how similar all nails look like. And if you cover the patient history and just show the image, you can be fooled very easily. So some of them are fungal, some are not. Some are partial fungus with some dystrophic nails. And some, I don't know if some had onychomycosis here. Maybe this one, maybe this one, but sometimes onychomycosis can be easily fooled by onychomycosis. So here you can see few cases that if you wouldn't see the titles, you would think that it's onychomycosis. So onychomycosis, it's basically the nail does not adhere to the nail bed and there is an air gap, and sometimes it looks white, but sometimes it looks yellow. It's super hard. Psoriasis, sometimes you can see that it's psoriasis, but sometimes it really looks like onychomycosis, and sometimes psoriasis exists with onychomycosis, coexist with onychomycosis. So why did we develop PCR? Because the available diagnostics was not there. So we actually work with Dr. Alexander Rabinovich. He is orthopedic surgeon. He supervised our study, and he looked at 50 cases. He said that it's onychomycosis. He saw many cases. He actually normally removed the nails. This is why he really liked our technology. But believe it or not, 48, not like 10, 48 out of the 50 were false negative. And I will tell you soon why it doesn't work. So they did culture in 2 big labs in Canada, and it's super hard to grow dermatophytes. So the winner is PCR. I will tell you why it's working so good. So you see here, we looked at 593 samples with suspected onychomycosis. 361 were found culture negative, so more than half, and only 232 were culture positive, where most of them actually were infected. So what's the alternative to culture? Nothing. So here we looked at, we actually compared KOH, fungal culture, and dermoscopy. This is where you take the nail and look under the microscope. This is really good to actually find other modalities such as cancer. Histopathology, it's where you stain the nail and look under the microscope, and there is a fungal culture and KOH. So these are the main approaches. There is culture-based and non-culture-based. I really like this approach because it's much faster and much more accurate. So you see, this is a culture. This is after 2 days. This is after 7 days. Look how slow it grows. And this is after 4 weeks. So can you even see the culture after 4 weeks? Barely. And also what's happening sometimes, there is, you see here, for example, this is environmental mold. The mold grows super fast. After 3 days, you have this whole petri dish covers with mold. And then it eats on the nutrition, and forget about it. You cannot grow any, you're not going to ever see dermatophytes. By the way, sometimes when we did it, so people that work in the garden, they have fungus. It's non-pathogenic fungus from the garden, but it's again eating all the nutrition is growing much faster than dermatophytes. So this is, you see, this is a nail that didn't have fungus, and this is how it looks with dermatophytes after 3 weeks. Another problem is sampling errors. So if a family doctor, I hope we don't have family doctors here, they really don't like to take samples. If they do, so they barely touch the nail and they just send it to the lab. And if you don't have, this is the quantity that needs for culture. If you don't have it, if you don't have, take the sample from the proximal edge where you have enough live fungus, it's never going to grow. There is direct microscopy. This is actually, we did it in our lab. So this is hyphis stain with a really, it's called cancofluor, so it's a very unique fluorescence. And this is how yeast looks like. So why do I like so much PCR? It's super exact. The way it works, I will explain. So you basically translate a sequence on the DNA of the fungus, a very specific one. So if it doesn't match, so it's not going to translate. It's super accurate and it's very cost effective and fast. The PCR takes only, for us it takes 3 days to process, but it's taking a couple of hours actually. So this is the benefits of a PCR. It's very sensitive, rapid. It's broad pathogen detection, and we can identify difficult to find cultures. So this is all the species that we can find. Dermatophytes, Candida aspergillus, and here you can see our progress. If it's not dermatophytes, normally it's dermatophyte, but if it's not, so we have a flow chart and we test other pathogens, and this is our technician legion. So PCR works like a copy machine. So you take the nail. We have a very, very good way of extracting the DNA, and then we put the primers and we shuffle it in this photo PCR. So it's basically doing cycles and spit out many DNAs. So this is why even if the infection is very mild, we will detect it. So this is the process. We sample, we lyse it. So we need to extract the DNA out of the keratin. We incubate it, we vortex, we centrifuge, and then we run it in the machine. So that's it about the PCR. And maybe I will stop the sharing and we can take more questions.
I'm unmuted now. While we do that, I'll just start sharing my screen for the webinar specials as well. Oh, I have to send a request.
Sure, here.
Perfect. Okay, did we have enough questions to continue the Q&A, or should we start with the webinar promotions portion?
Yeah. It's okay.
Okay.
We can do that and then answer questions.
Okay, perfect. And you see my screen with the webinar promotion slide?
Yes.
Okay, great. So before we continue the Q&A portion of the evening, I just wanted to share our Pedicare webinar specials. So for everyone attending tonight or for everyone listening to the recording, we currently offer promotions on both the ToeFX lights. So Irit didn't go over the lights in the presentation, but Both of these lights are effective and they're both Health Canada approved for treating onychomycosis. The difference between the two lights are so the light on the left-hand side, it's the Clear Toe 1000 and black lights. Those lights are more portable. It has a 30-minute total treatment time, and the cost of that light is $2,800 for a double light package. And the light on the right-hand side, that's the newer 2000 blue lights. So those are a bit bigger, more suitable for in-clinic use, and it is a higher intensity light with a dual wavelength of blue and red light. So it's got a shorter treatment time of 17 minutes, and pricing-wise, it's $6,800. So with the purchase of either of these double light bundles, you can choose to receive a free add-on. So you can choose the free ToeFX burr kit, which is valued at $102. It includes 3 burrs. So there's a diamond ball burr. That's the one on the very left. That is so that's the diamond ball burr. That's effective for cleaning nail folds, fungal spots, and streaks. And then in the middle, that burr right there is the NEM burr. So that's a dual cut burr with a thin tapered cone shape that's designed to work along the nail sulcus and also for debridement of the lesser toes. And then that big burr on the right, that's a Tyane burr. So that's for efficient debulking with low heat generation. So you can claim that kit with promo code TOEBUR. That's right on the slide there. And then the other free add-on you can choose instead of the burr kit, if you have enough burrs, you can choose an additional free serum pack. So that one's valued at $120. And since there's already a serum pack included in the double light bundles, you're receiving a total of 2 serum packs with your purchase. So technically your first 2 clients are on us. And then these promo codes will be sent to you in a post-webinar email. So you can screenshot this page. If not, you can refer to the e-blast that you'll receive after this webinar. And you can choose to either order online at pedicare.ca. All you need to do is have a professional account, add the double light bundle to your cart, and then add either a ToeFX serum or a ToeFX burr kit. And then once you put in that promo code, it'll be free. So you can either order online or you can contact one of us. So you can contact myself or Veronique. And if you have any questions about the ToeFX devices or the serums or anything at all, just feel free to reach out. And then should I just leave this on the screen while we continue the Q&A portion, do you think?
Sure.
Okay, perfect. Okay, getting back into the questions. We have one question from Paula. She is wondering what types of wounds can be treated.
Paula, how about you, Amy, can you allow me to share my screen for a second?
Oh, yes. There you go.
We'll share. Here, so you have my email address here, so, and my cell phone number. You can always text me until midnight. And this is my email. Please feel free to ask me questions about the wounds. Because we didn't do any clinical study yet. I just said that, but anyways, I'm happy to share the details. So please feel free to book a meeting with me.
And then Edna is wondering if this is approved for use in the USA.
Yes, it does.
Okay, and Kara asks, is it still okay to apply a clear polish after the treatment, or is this not protocol anymore?
Yes, it's okay. It's not recommended, but some patients, I understand that they want nail polish, so yes, it's just blocking the evaporation of the moisture from the nail bed, and also it doesn't allow oxygen to penetrate through the keratin and to help with the overall healthy nail bed and anti-inflammatory, but yes, it's okay to put nail polish. I always advise that if a patient really wants a nail polish, so maybe ask them to take it off if they have an event or whatnot, so to reduce it to minimum. But yes, it's okay.
And Manisha is wondering how long does it take for the blue dye to clear from the distal edge of the nail plate?
A week, something like that. Not too long.
Okay, Sherry Ann is wondering, is one serum enough for the period of time for one client?
One serum is one
Sorry,
pen.
one treatment. Yeah.
Yes, one serum is one pen, so it's designed to be one-time disposable, one-time use. It's good to use for on 10 toenails and then dispose it. So it's one per session. It's really important to use it that way just to avoid cross-contamination because you can reintroduce the infection. I hope I answered the question.
Thank you. Okay, I'm not seeing any more questions come in, but if anyone has any more questions while Yurit is here, please either raise your hand and feel free to join us or type your question into the question and answer.
And if we have here some ToeFX users, so feel free to share your experience or maybe ask us questions.
Okay, Shelly is wondering, so I have a client leaving the country somewhere around 6 treatments out of the 10. He does not want his nails to be blue during the time he's away and has asked me to take off/stop. And she said it will be about a 1 month break.
Sure. So, yes, you can remove some excess of the blue after the treatment by using rubbing alcohol. It will dissolve part of it. 1 month, it's a lot between sessions. So please feel free. Please make sure that you prescribe or ask him to, depends on which species he has, but assuming that you know, so apply topicals, especially when he will be away, so it will not regress. So you can ask the family doctor to prescribe Jublia, or maybe ask him to buy Tenactin over the counter, but just to use something while he's away.
Okay, and Jacqueline is wondering if vinegar is good for cleansing OM.
No, it's so if it's superficial onychomycosis, the vinegar, what it does, it's lowering the pH, so it might help a little bit, but overall it's not helpful. So I heard that patients soaking their feet for 2 hours a day in vinegar, then it's causing them other issues, but it's not. You heard, right? You know that onychomycosis, the fungus is so stubborn, so no, it's not going to help.
Okay, thank you. And Mary Beth is wondering if someone is one of the unsuccessful, is it better to extend the treatment or wait than do an entire 10 treatments again after a period of time?
We recommend to treat 10 times. We found that it's not going to progress, help with the treatment if you do more than 12, I would say. We always advise to move to maintenance where you see the patients every 6 to 8 weeks. So it depends on the situation. I can gladly look at the pictures and advise further.
And Mirka is wondering what is the recommended cost for the patient per session?
Redita, maybe you want to answer, please?
So Mirka, it depends, but most of the podiatrists, clinicians in Canada, they're charging 120 to 150 per session.
And sometimes we recommend to ask for a package. So, for example, X amount for a treatment, let's say 120, and if they prepaid for 10 sessions, so you offer them a discount.
And Shelley says, thank you. I have also been told over-the-counter clotrimazole was an option. Sorry, I butchered the
Yes.
pronunciation. And then Zoe says, I have a client who swears that rubbing Vicks Vapor Rub will fix the fungal issue. Is this true? And how can I explain? No, it does not.
So, no, it does not. So, the issue is, as I described previously, the issue with treating onychomycosis is because it's perfect environment for the fungus. They have the protection of the nail plate. So most, actually all the topicals cannot penetrate so well. Unless you do micro drilling or really file down the nails, but still, if there is a nail barrier, it cannot penetrate. So because the penetration is not great, it's not going to work with a fungus, unfortunately, unless it's very, very, very mild and superficial onychomycosis. It's super hard, especially with dystrophic nails, that it's reach the proximal edge and especially the corners, and the matrix is also involved, so topicals are not going to help in those cases. Actually, in the States, the podiatrists distinguish if it's mild case, so there is onychomycosis severity index. I can actually send information about that, but if it's mild case, there are ways to measure it and you give scores. So if it's mild case, topicals might work. Moderate to severe cases, those are the patients that normally come to see you. It's not going to work and you need to offer them other treatment. Oral can work, but also ToeFX, and if you use it in conjunction with topical or other supplements or biotin, and zinc, there is biotin and zinc and others, it will actually work very well.
So would you say tea tree oil is similar to like Vicks Vapor Rub? Because Mary Beth has multiple clients that swear by tea tree oil too.
Tea tree oil, it doesn't penetrate the nail, it's oil. And through the nail, because the pores are so small, so water can penetrate, but not oil. And also, I'm a toxicologist, so the problem with tea tree oil, especially when it's concentrated, it can be very, very toxic to the skin. So often people, when they use too much tea tree oil, they have rashes.
And Sherry is wondering if there's any video demo that you can share on how to use the product. She's wondering if we need to reduce the thickened nail first and then paint the serum and then shine the light for a certain amount of time. And I think these questions can be answered with the ToeFX Training Level 1 course.
Right.
So the ToeFX Training Level 1 is free. I believe the URL is learn.toefx.ca. Okay, perfect. So if you go to that website, you can sign up for the level 1 training, and that includes a lot of videos on how to use the product and just a lot of like guides and resources. So that would help you learn how to use the product.
Amy or Redita, can you share your screen for a second, showing the how to access that?
Yes, I'm just going to do it. Yeah,
Okay.
I have it open.
I think Laura Desjardins raised her hand. Or maybe.
Can you see my screen?
Yes.
So here we have all the trainings. If you go to ToeFX website, you'll see products, and you can click on the product as well, or in the home page, you can just scroll down, and here you can start a training. So if I click starting training, It's taking me here, and see this part one training is free, so you can just add it to your cart and start this training for free, and you will learn about the ToeFX science and the protocol and everything here. And this one is more elaborated for after purchasing the ToeFX device. Before providing the treatment, you need to take this part of the training. It's also included in the part of the light packages.
So you don't need to pay extra, yeah.
Yeah.
Thanks, Fredita. So Shelley is wondering if there's any chance this will be an insurance coverage product at a later date.
So there is an insurance coverage for some of, for example, for onychomycosis treatment or foot treatment, there is insurance coverage, so you can claim the insurance through that, not specifically on ToeFX, but there are ways to claim to do it through the insurance. Yes.
And then Jacqueline, she has a young daughter and she's wondering how she can prevent it from going on her daughter's toes. She noticed that it could be on it already.
What? The fungus?
Yeah, it sounds like fungus.
You need to treat it.
And then Kara has a question about the burrs that we recommended. So for the 3 burrs that we had as part of our burr kit, those were just recommended by a foot care nurse educator, and she had just chosen the top 3 burrs to use for nail debridement. But you can use any burrs that you prefer. Those are just the most, I guess, efficient ones for toenail debridement for the ToeFX treatment.
I wanted to add about the burrs. The reason that it's good to use for ToeFX because there are 3. It's carbide, so it doesn't create heat. Also, there is one thick one, so it's really good to use it at first, just to eliminate the width of the fungus of the nail. Then there is a finer one to smooth out the nail, and there is a small ball burr. So it's really easy to use it to open crevices on the nail itself to allow the formula to penetrate, or also to use it at the proximal edges to create kind of a small pool, so the formula can penetrate through there to the matrix.
You can
So
get really
those
precise
shapes are
with
very
that burr.
unique and specific for ToeFX. Yeah.
And then Laura is wondering, does 40% urea cream used in between treatments help the efficacy for ToeFX or topicals?
I don't think so, because you're doing mechanical debridement of the nail, and urea soften the nails to help with the penetration of, for example, topicals. No, it's not going to help. You can try, but the problem with urea that it also has water, so it might block the penetration of the formula through the nail plate.
And then Paula is wondering about coverage through NIHB because all her clients would be covered through NIHB.
I think it's covered, food treatment.
And then just going back to Jacqueline, she has a young daughter with fungal nails, or she's starting to see fungal nails, and she was just asking about prevention.
Prevention? So again, to prevent reoccurrence, we recommend to continue to offer ToeFX for every 6 to 8 weeks until fully cleared, and in between to apply topicals. And also patients should disinfect their shoes with spray, wash their socks in high temperature, disinfect the nippers or whatever they are using, and if they sweat a lot, to replace socks twice a day. And also something exciting, we are working on disinfectant chamber. It will look like an oven. You can put it in your clinic and shuffle shoes while you treat the patients with ToeFX, and it will disinfect them. It will be superior to everything that I saw in the market. Sprays do not work so well because it doesn't kill the spores. UV also, it's a light that doesn't travel so well, so all the corners of the shoes, it doesn't reach it. So this will be very cool. We are testing it, so I'm super excited.
Interesting. Does it remove smells as well?
Yes.
Odor? Oh, okay, cool.
It has ozone, UV, and heat.
It's very interesting. Thank you.
I want to meet the fungus that could survive this.
And Zoe is wondering if they will be receiving a certificate for attending today because she would like to provide to her audit for CLPNM.
Vedita?
I think you can put hours there. Like it was a 1 hour session. You can put hours. Yeah.
Sherry asks, does it need to be confirmed OM, examined FR lab to be treated by ToeFX? Because as you shown earlier, OM can be confused with other conditions.
Yeah, so no, it's not mandatory, but it's super helpful to diagnose onychomycosis prior to treatment because you want to really make sure that you're treating the right modality. So I highly encourage you to do testing before you offer any treatment. It's like doing a throat, you send it to the lab to make sure that you have a bacteria infection, strep, right? So the physicians do not want to give antibiotics without confirmation. So same here, you want to make sure that you are treating the right modalities, and also you will get better results.
With Laura, she says that her college does not like them taking samples. So how is the best way to go about the PCR testing with prices, and can they sell it to the patients to send it in on their own?
Yes, Laura, I think you can sell it to the patients, and I think I sent you an email about that, but if you didn't get me, so shoot me another email. I will resend it to you. We know about the college, yes.
And then Kara's wondering, so once the ToeFX treatments clear the onychomycosis, is it recommended to offer further ToeFX treatments? And if so, what is the frequency that is recommended?
Yeah, so we recommend to continue to see the patients for a couple of times, every 4 to 8 weeks, depends on your up to your discretion, just to make sure that there is no relapse. And if the patient is safe and it's stable, so they are off the hook. Yeah. But always patients that are older and more susceptible, patients that are 60 and older are more susceptible to get it again. So it's good practice to see them every couple of months.
And then Sherry says, so we'll advise them to ask the doctor for an order of PCR.
No, you can do PCR. You don't need a doctor for that. You can take a sample and send it to us. You can reach out and we will explain how it's being done.
I think that's all the questions we have for tonight. But if you have any other questions or you think of something later, you all have a cell phone number now. She said you can contact her until midnight. Or feel free to reach out to me or Veronique or Herdita. We're happy to answer your questions after tonight's webinar as well.
Thank you very much.
We will have, sorry to interrupt. We'll have a webinar promotion on PCR test as well. So tomorrow you will get email about that.
Bye, everybody.
All right. Thank you, everyone.
Bye, everyone.
For joining us tonight.
Thank you. So hi,